Hi, my name is Sydney. I'm a second year MPH student here at Tulane, and I'm in the Social, Behavioral, and Population Sciences department.
And my name is Jaslyn Taylor, and I am also a second year here at Tulane in the Social, Behavioral, and Population Sciences department. And both Sydney and I are in the Maternal and Child Health program.
And we're here today to talk to our advisor as well as Professor Dr. Shokufeh Ramirez. So hi, Shokufeh. So how did you discover public health?
So I grew up not really knowing about public health, which I like to think I'm not the only one. And this was despite growing up here and having various family friends come from around the world to get their Master of Public Health here at Tulane. So I went off to college and studied anthropology, which at least for then hit that sweet spot of understanding more about people and interactions and culture and society. And as part of that, took some classes focused on health and disease. And so I think for me, I had long had an interest in health and well-being, not healthcare per se, but just how do we contribute to the physical, mental, emotional, spiritual health and well-being of all. And what we now, or I know now, is more the social and structural determinants of health. And so completed college, went to China for a couple of years to teach English. And while I was there, thought about what I wanted to do next and hit upon doing an MPH. Came back to New Orleans, came to Tulane, in the International Health Department. That seemed like the path forward for where I wanted to work. Had an interest in women and children, and while I was here, decided to take more epidemiology courses because that was an interest I discovered while I was here. So I graduated from the International Health Department, but had also built some additional experience in epidemiology.
So Shokufeh, where did you start in your public health journey and how did you get to where you are now?
So when I was doing my MPH, I did my practicum at the State Health Department, and I think it was to my benefit that I was able to say, I'm interested in epidemiology, specifically infectious disease epidemiology. So my practicum was not related to that, but there were people at the health department that knew what I wanted my next steps to be. And so as I was finishing up my practicum, a job opened up in the infectious disease epidemiology part of the health department. I applied, I interviewed, and was able to start working right after graduation. So I feel really lucky about that. And so I was an epidemiologist covering part of the state, doing surveillance around infectious disease for part of the state. And then soon after, West Nile virus hit the United States, and I had already been working in the area of arboviruses, arthropod-borne viruses, with Eastern equine encephalitis, and so it was a natural progression to shift to West Nile. And so started working on surveillance with that and various, mosquito people around the state, developing that interest and expertise. And after I really enjoyed that job, enjoyed the people I worked with, the work I was doing, but decided to move to Chicago, where my now husband was living. We met here in the Tidewater elevator when we were doing our MPHs. So I decided to move to Chicago and then worked for the Cook County, which is the county that encompasses Chicago and is like a ring health department around the city, and worked as a tobacco epidemiologist. So that was at the time of the big tobacco industry settlements, and so there was effort being put into surveillance around that. And then worked for the city of Chicago as a lead poisoning prevention epidemiologist. And so I would say that was probably my first foray into working in maternal and child health, focusing on lead poisoning prevention in children, and really recognizing that that can shape their whole lives. After 2 winters in Chicago, decided that was not it for me. and so applied for a job in Hawaii, somewhat on a whim, and got the job, and as an epidemiologist, again, in infectious disease. And what I found out later was part of why they hired me, a big part of it was my experience with West Nile virus here in Louisiana. So there in the state of Hawaii, there were ecological ramifications, not just human health. And so that was a really great experience for me, getting to work across industries, working with the shipping industry, the U.S. Postal Service, U.S. Fish and Wildlife Services, across the health department, communications. So just seeing how important it is to work in step with others, each of us bringing different expertise and often different interests around an issue, but working towards the same goal. In that situation, preventing West Nile virus coming to the state of Hawaii. And a lot of the work we did applied to future surveillance and systems in the state around other diseases. After several years there, really loved it, but Hurricane Katrina hit New Orleans and the levees broke, and it was really important to me to come back home and support the city for a while. And so moved back here 6 months after Katrina in time for the first post-Katrina Mardi Gras with my 3-month-old son, and thought it was going to be temporary. We were here just, trying to show support, supporting my family who was out of their house for a while. And looking back, I think about what a unique time it was, that my son was one of the few infants that people saw, so helping bring that energy. And after a while of maternity leave that I had given myself, which everybody should have, but anyway, I was able to give myself that leave and decided I wanted to come back to work. And so applied for a job at Tulane as a staff member in maternal and child health. And so that kind of shaped the last 16 years of my life. So came on as staff doing monitoring and evaluation, getting to work with students. And it was an adjustment for me at first because I was so used to working in health departments. And it wasn't until the first cohort of students I worked with graduated that I was like, oh, this is what I'm doing. I'm not serving the public directly, but I'm helping prepare students to serve the public. And so have worked with students in some capacity for the past, as I said, like 16 plus years. And along the way decided to get my PhD while I was here. I really enjoy teaching and helping students prepare to enter the workforce.
And so going off of that, what area of public health are you presently working in?
I focus on health equity and maternal and child health, which I think are intricately tied. I think that we cannot address public health in this nation or really in the world without addressing maternal and child health and making sure that everyone has the best start at life as possible. And part of that is making sure that everybody gets that. So that it's done in an equitable fashion. So my focus is particularly racial health equity, which I think is particularly relevant to the United States and our context here. And so I teach a leadership and communication class, which I often describe as helping students figure out what they want to do with their lives and help them get there. I'm the associate director of the Center of Excellence in Maternal and Child Health, which is a federally funded grant to help develop the maternal and child health workforce. And I've been associated with the center my entire time here. And starting in the spring, I'll also be teaching a health equity course. So my dissertation did focus on addressing racial health equity in the future public health workforce. So how do we best train our students to do that?
And what advice do you have for prospective students, specifically those that would like to get into the maternal and child health program?
Yeah, so I think public health is really broad, maternal and child health is really broad, which provides a lot of opportunity. I think it can also provide a lot of confusion about direction to take, and that's okay. Like, we don't have to have it all figured out from the beginning. As you heard, my path has been circuitous, and I think that that's fine. So it's good to try things and see what works for you, what doesn't. And I think part of that is making sure that you're putting effort into seeing if it works. So does this topic interest you? Does this population interest you? Does this work setting interest you? And so I think specifically within maternal and child health, recognizing that it is not just about the mother-infant dyad, which is important and critical, but maternal and child health is much broader than that. So it includes children and adolescents and families. I think a big part of that is the perspective that brings to the work that one does. So looking at what is the impact of what happens now on the future, what is the impact of an equitable or non-equitable situation, what are the circumstances that shape the lives of individuals and society as a whole is important. And I think the other piece of advice I would give is there are a lot of shoulds in terms of there are things we should do to address public health and to address maternal and child health. And that's important. And we want to combine that with the things that are important to us that like touch our hearts. And so for each of us, spending time and energy to figure that out is important. And again, it doesn't have to be figured out immediately, but doing something just because it should be done is not enough. It should also be that it touches you. Leave the should that doesn't interest you for the person that it does interest, and focus on your own path, because I think that ultimately is of benefit to me and you, and to society as a whole. Like, if we're all just doing what we should be doing, I don't know that we'll be happy, which is an important part of life. And so we can do good work and be happy doing it.
Thank you so much for your time, Shokufeh. This has been wonderful to get to know you a little bit better, and to hear about your journey in public health and just about you overall.
Like Sydney said, thank you so much for taking your time out today to come and speak with us about your public health journey and career path. And we just look forward to seeing future things about you.
Thanks so much for having me. I enjoyed chatting as I always do. As mentioned, I enjoy working with students, and it is truly a joy to see each person come into their own, and it feeds me along the way, and hopefully I too will come into my own.